Welcome to the Fraud, Waste, and Abuse section of the annual Momentum for Health Compliance training. Here we will be discussing fraud, waste, and abuse. It's important to remember that our efforts to review and understand fraud, waste, and abuse are connected to our overall agency mission and values. Our mission is to help individuals achieve mental and emotional health, discover and reach their potential, and fully participate in life. Our values are respecting individuals and their differences, demonstrating integrity, striving for excellence, and caring. Minimizing fraud, waste, and abuse not only protects the rights of consumers and our organization from liability, but it also protects our workers and us individually. Our objectives are as follows. We're going to understand the 6 fraud and abuse laws. We're going to go over the definitions of fraud, waste, and abuse. We're going to understand how fraud, waste, and abuse applies to the work you do and how to avoid engaging in these activities. And we're going to know where and how to report it if you suspect that fraud, waste, and abuse has occurred. There are 6 fraud and abuse laws. Here we're looking at 3 of them. FARA, or the Fraud Enforcement Recovery Act, expands the scope of several existing fraud laws. It increased funding for federal agencies that prosecute fraud and extended the scope of the False Claims Act. So, what does this mean? An example would be FARA expanding the definition of a claim to include any request for money or property offered to a government employee or official, as well as requests to contractors working on behalf of the government. It expanded the definition of fraudulent activity to include attempts at defrauding the government, regardless of whether the government had the money or not. This provided more protection for the government. The False Claims Act protects the government from being overcharged or sold shoddy goods. It also provides oversight for Medicare and Medicaid. For example, it's illegal to knowingly submit false claims. The Anti-Kickback Statute prohibits individuals and entities from getting willful and knowing payment of remuneration, essentially getting rewards in exchange for patient referrals to federal healthcare programs. In some industries, kickbacks are okay, but in the healthcare industry, we're not allowed to get kickbacks, payments, or rewards for referrals. The Stark Law prohibits physicians from referring patients to receive health services payable by Medicare or Medicaid from entities with whom the physician or immediate family member has a financial relationship. Doctors can't refer to another doctor with whom they have a financial relationship or with whom they would get some type of benefit. The Whistleblower Protection and Non-Retaliation Law says that it's unlawful for an employer to retaliate against an employee for disclosing information to a person with authority over the employee. If you suspect fraud, waste, or abuse, it's unlawful for any type of retaliation to happen against you because you're reporting that to the employer. There are also program exclusions. For example, the Office of the Inspector General, OIG, is required to exclude the following people from participation in all federal healthcare programs: people who have committed Medicare or Medicaid fraud, people who have abused or neglected patients, individuals who have felony convictions for other healthcare-related fraud, theft, or financial misconduct, and individuals with felony convictions for unlawful manufacture, distribution, prescription, or dispensing of controlled substances. We, as an agency, have to do monthly checks on these databases to make sure that no one who works at Momentum for Health is on these exclusion lists. What is fraud? Fraud is intentional deception or misrepresentation to obtain unearned profit, such as incorrect billing, wrong diagnosis, codes, and billing for services not provided. It also includes other attempts to gain benefits not entitled to, such as the client not having Medi-Cal. Additionally, if there is intentional deception to obtain more referrals or good standing, it counts as fraud. Fraud is an intentional deception. It's knowingly doing something that's incorrect in order to obtain unearned benefits. Some examples of fraud are billing for appointments the client failed to keep, knowingly billing for services at a level of complexity higher than the services actually provided or documented in the file. For example, if you knowingly billed for therapy services when you actually provided case management services, that would be considered fraud. Knowingly billing for services not furnished, supplies not provided, or both, including falsifying records to show delivery of such items. Paying for referrals of federal healthcare program beneficiaries. These are all examples of fraud. Here's a case example. Billy is a clinician who met with a client named Tommy for an assessment. Tommy reported he hears voices that tell him that he is a bad person and should die. He has anxiety, disorganized thoughts, and difficulty maintaining social relationships. He stated that these symptoms have been occurring for about a year. More recently, Tommy stated that he has been drinking alcohol in large amounts over long periods of time, craving to drink alcohol, and has been having difficulty maintaining his employment. He stated that the drinking has been occurring for the past 3 months. Billy completed the intake paperwork and the mental health assessment after meeting with Tommy. He entered the primary diagnosis as schizophrenia, even though he felt that alcohol abuse disorder should be the primary diagnosis to make him eligible for services. What's important to keep in mind here is that this is fraud because Billy knowingly diagnosed Tommy with another primary diagnosis in order to make him eligible for services. He knowingly misrepresented what his actual assessment was of this client. This concludes the fraud portion of this training. Now we're going to talk about waste. What is waste? Waste is the misuse of resources. It can be direct or indirect. It can be the overutilization of services, such as providing a client with the same service when the client doesn't need it. It can also be the careless or needless spending of funds, such as providing services to a client that they don't need. It can also be services that result in unnecessary costs. Waste is different from fraud because it's not usually caused by criminal intentions. Some examples of waste are the same activities being performed in different ways by different people, making copies of multiple forms with the same information, misuse of supplies and resources and time, not connecting similar projects and functions, which results in wasting time, staff energies, and creativity. We're going to go through a case example. The case manager, Sally, meets with Tommy on a weekly basis to provide services. Tommy's symptoms have been improving since he has been in treatment and has been making significant progress. After evaluation, it was determined that Tommy does not require weekly sessions. However, Sally continues to meet with Tommy every week. After evaluation, it was determined that the frequency of sessions could be reduced because that was what Tommy needed. However, Sally continues to meet with him weekly. Sally meeting with Tommy more than required would be considered overutilization of service and would be considered waste. Tommy did not need weekly sessions, so Sally should not have been providing weekly sessions. Sally should only provide the amount of service that Tommy required. This concludes the waste section of our training. Now we're going to talk about abuse. What is abuse? Abuse is the practice of misusing existing policies or practices, misusing billing codes, such as upcoding or unbundling, billing for duplicate or unnecessary services, overcharging for services or supplies, manipulating a person's situation or the system for personal benefit. Some examples of abuse are providing duplicate or unnecessary services to clients, billing for unnecessary services, charging excessively for services or supplies, misusing codes on a claim, such as upcoding or unbundling codes, and taking advantage of a person, policy, or process for one's personal gain or advantage. Now we're going to go over case example 3. Sally met with Tommy and provided targeted case management services. Sally completed her progress note in Avatar and billed for the session. When the county shared the service report, they notified us that Sally accidentally billed the same TCM service twice. The county staff noted that the duplicate billing of some services has occurred before with Sally and informed Momentum of the need to follow up with her. Sally submitted a duplicate service to the county. The practice of Sally submitting the duplicate service would be considered abuse. This practice can lead to unnecessary costs, which would be considered waste. The time that it takes our admin staff to then look at the duplicate billing and then delete it and fix it would be all wasteful and unnecessary. We need to be mindful of that as well. This is not fraud because Sally did not intentionally bill the county twice for the service to gain unearned profits. It was not an intentional thing that she did. Fraud is something that is knowingly and intentionally done. This concludes the abuse portion of this training. Next, we're going to go through a combined example. The case manager, Sally, met with the client, Tommy, for an individual rehab session. When they met, Tommy started to tell Sally that he loved strawberry ice cream and loved the latest Harry Potter movie. They started to talk about their favorite scenes in Harry Potter and their favorite characters in the movie for the entire session. When Sally wrote her progress note, she billed the note as individual rehab. Sally used the service code for individual rehab when she knew that this was not the service that was provided. It's important to note here that the purpose of the visit was individual rehab in order to help Tommy build his skills so that he can improve areas of his functional impairments as identified in the assessment and not to be another friend. Talking about strawberry ice cream and favorite parts of Harry Potter is not a billable service. Billing the note as individual rehab would be fraud. This activity would also be considered waste because it would never improve Tommy's functional impairments. Therefore, it's also an unnecessary use of resources. Now we're going to talk about the relationship between unnecessary spending and performance. As we decrease unnecessary spending, fraud, waste, and abuse, we can increase our performance. We can increase protections for whistleblowers, strengthen our laws, increase our exclusions, and increase our integrity. We want to make sure that we're always having good integrity of the chart and that we have less fraud, waste, and abuse issues. Here's a wrap-up of our training. Fraud is the intentional deception or misrepresentation made by a provider, entity, or consumer with the knowledge that the deception could result in some unauthorized benefit to which they would otherwise not be entitled. Waste is the overutilization of services, careless or needless spending of funds, or other practices that directly or indirectly result in unnecessary costs to the healthcare system. It is not generally considered to be caused by criminally negligent actions, but by the misuse of resources. Abuse includes practices that are inconsistent with sound fiscal, business, or medical practices and result in an unnecessary cost to a healthcare benefit program or in reimbursement for services that are not medically necessary or that fail to meet professionally recognized standards of care. Here are some main points to keep in mind. Be honest and claim only diagnoses and services that were assessed and provided by you. Be mindful and do not use resources carelessly and incur unnecessary costs. Do not engage in practices of misuse or in practices that are contrary to other legal rules. Report any activities that may be considered fraud, waste, or abuse. The next steps are as follows. Complete the quiz. Review, understand, and comply with fraud, waste, and abuse guidelines. Report non-compliance and concerns. Continue to review this information with your team and consult on any questions. Ensure that you complete all 3 compliance trainings: HIPAA and confidentiality, fraud, waste, and abuse, and the Code of Conduct. Thank you for taking this training. If you have any questions, please feel free to contact the QI department at dg-qi@momentummh.org.